Hey guys, welcome back to PrettyJoli. So first and foremost, thank you so much for jumping back on. Today's topic is respiratory therapy. So that's what the RRT stands for at the end of PrettyJoli_RRT, which is my Instagram. It's registered respiratory therapy. I have a good amount of people who DM me or text me, just ask me what exactly a respiratory therapist is. What do we do, and do I love my job or do I hate it? So we'll just kind of cover those few topics so that if I have anybody else ask me, I can just direct them to this, hopefully to this channel or to this video, and it will answer all of their questions. So we'll start out with the fact there are two different kind of like credentialing as far as being a respiratory therapist. There's CRT and RRT. CRT is Certified Respiratory Therapist, and RRT is Registered Respiratory Therapist. It's a lot like LPN and RN. So I am a Registered Respiratory Therapist. I currently have worked in critical care, in emergency room, and spinal cord injury, but there are a lot more other fields you can get into or specialties you can get into as far as pediatrics, sleep studies, or pulmonary function testing. So doing critical care or emergency room or just nebulizers, there's a lot more to it. So let me think of some of the questions. A lot of people obviously ask or inquire about pay. So as a new grad here in Tampa, Florida, I can tell you you're going to start out making from $21 an hour up to $26 an hour within your first year probably, depending on, again, where you work, who you work for, and that's that. And maybe if you have any prior medical experience, like I did have my CNA and my EMT, and I did already work at the hospital that I ended up getting my RT job at. So some of that stuff they look into and maybe can help you get $1 or $2 more starting out. Then you can, and also it depends on if you're going to work full-time or what they call PRN or fee-based, depending if you work for private sector or government. But that's going to be more money because if you're working PRN or as needed, then you're not going to be getting the benefits like your health insurance and stuff through that agency or through that company that you work for. This is going to allow you to get more money an hour. So you could start out making more than 21. You may be at 24 versus the 21 they were going to hire you at full time. So someone who's been doing it for a few years would be offered around $28 to $29 an hour here in the Tampa, Florida area as a respiratory therapist. So that's my knowledge on paying. That's in the year experience that I've had being an RRT, that's what I have found out. Hopefully that gives you a good foundation to start on or allow you to ask some more questions other than just Googling how much does a respiratory therapist make in this area. So next we'll jump into what do we do? Well, I can speak from my standpoint, being a critical care therapist. We manage ventilators, we do intubations, we do extubations, we insert arterial lines, which is a procedure you do for monitoring pressures or grabbing arterial blood gases, which you can do either by sticking a patient in the artery or using the A-line. We also, again, it depends on what field you work in. You can do pulmonary function testing. That allows you to see whether a patient has obstructive or restrictive diseases. That's going to be more of a clinic job. You can work in the sleep study area, which is going to determine whether a patient has sleep apnea. What else? Oh, they have barrack chambers, which is really cool. You could do that. You can do home care, which is patients who may be living at home on a ventilator or just need any type of respiratory, whether they live with a trach, but they're not on a ventilator, they just need like trach equipment or trach changes. We might have respiratory therapists going to the home and doing that. So with what I do, I would float around to all the units depending on my assignment. So let's say we had surgical ICU. I would maybe have a post-heart come out. I would work with the nurses and the doctors to get that patient extubated and getting that patient breathing back on their own and off the ventilator, and work with them to strengthen those muscles, doing incentive spirometry or doing aerobicas to make sure that their lungs stay clear. And they also do things like easy PAP. There's a lot. I mean, it's called respiratory therapy. There's so many different types of therapy when it comes to our lungs. It's absolutely incredible. I love it. So that's a little insight to what you do. I would say that it's more of an independent job versus working as a nurse, because you can have multiple assignments all over your hospital, like have patients all over the place. So you're just gonna be working on your own, have your own time management, and know your tasks, know what you are trying to achieve within that assignment, within that shift. And you just kind of do it on your own, you just do it yourself. And as long as you do it right, correctly, and efficiently, and you get all your charting done, no one's really telling you anything needs to be done a specific way, which I love that part about it. Nurses, let's say we're going to talk about a critical care nurse versus a respiratory therapist nurse. You're going to have a critical care nurse is going to be like an SICU, and they're only going to be an SICU, and their couple patients are going to remain in SICU unless they have to do a transport, but they'll be right back in SICU. So with respiratory, I may have SICU, ER, and maybe one other assignment. So I'm going to maybe be traveling. I'll maybe even have like a couple patients. It could be a lot of patients, 5 patients on ventilators. I don't know. But then also have like patients come into the emergency room who need to be started on BiPAP or CPAP and stuff like that. And again, if you have specific questions on what BiPAP is and what CPAP is, what is an ABG, I hope to do more videos in the future in regards to those, breaking those down, maybe even teaching some of that stuff to those who are trying to get through RT school or are looking into it. You may even be a resident and interested in the differences of an RT and an RN, or the differences of CPAP and BiPAP. So I hope to do that in the future. But I hope this answered your questions as far as like what an RT does and how much they make and if it's a good job. Again, I love it. I think that it's very independent and great time management. It still allows you to, care for others and be there for them and help them get better when they're sick, which is hopefully what your passion is if you're getting into healthcare. So thank you so much for jumping on to PrettyJoli. I hope you enjoyed this video, and if you did, please give it a thumbs up and subscribe. All right, guys, appreciate you. Love you so much.